My name is Steve Aydin. I'm a pain management physician. I did physiatry as my initial training and then did an interventional pain fellowship afterwards. I work in a private orthopedic group called Kale Orthopedic Center. I primarily focus on musculoskeletal medicine, interventional pain management, as well as doing regenerative medicine along with some other more invasive interventional procedures. So regenerative medicine is a very broad topic and there's a lot of different approaches to it. So things like platelet-rich plasma, bone marrow aspirate, stem cell injections. A lot of times we kind of inject these into the joints, the tendons, the ligaments. The subchondral or the interosseous approach is kind of a different approach, going through the bone and actually getting to the zone of ossification where the bone kind of creates cartilage and injecting that injectator product like the PRP or the bone marrow into that region from the back of the bone as it, filters into the joint. So it's a little different approach, and there's a little bit of research that's kind of coming out that's showing really good results with that than just injecting it intra-articularly or into the joint and hoping that it gets into the areas and causes a healing event. So what we do is we isolate the PRP. Or we isolate their bone marrow from the site of harvest, usually it's the pelvis. Then we process the platelet-rich plasma or the bone marrow aspirate, and then we'll inject it into the area where the injury or the interest of healing is to occur. For example, someone who has really bad osteoarthritis of the knee, and say it's on the medial compartment, we'll harvest or get the PRP, and then we'll actually use a trocar or a very thick needle and go into the bone to enter behind where that lesion or that significant degeneration is. And then under live x-ray, we'll kind of see where that needle tip ends up, and we'll try and avoid popping through and being right behind it, and then injecting the product that way rather than injecting it into the joint into an open medium and not really sure if it's going to stay there or kind of do its job where it's intended to. So for people that are looking to learn about regenerative medicine, the first avenues are really to do reading and do literature searches and figure out if it's a treatment that you want in your armamentarium or you think your patient population needs. There are several courses, and the American Society of Interventional Pain Physicians, along with the New York, New Jersey Society of Interventional Pain Physicians, provide a course that allows you to learn these things and kind of get familiar with it and get information from your peers and colleagues who do these things, so that you're just not out there doing it and not really getting good clinical feedback. Because this is an area of growth. We're not really sure what the right moves are exactly yet. What's the exact data or the randomized controlled studies that are showing how to do this the right way and get the best results. We're all kind of walking our way through the dark right now. So these kinds of conferences allow us to have that academic discussion with our peers and our colleagues and get to the bottom of what is the right move or what isn't, what's getting good results with one individual versus another, and really applying it in a good clinical setting.